So we're VendlyAI, a healthcare vendor evaluation tool. I'm Serena. I'm an MD MBA student at Harvard, and I work on the AI committee of two main hospitals in Boston. One of the biggest problems that we experience as a hospital system is deciding which AI vendor to use and integrate into our hospital system. And usually how we make this decision is we do a full-blown pilot, which is very expensive and very time-consuming. This would especially not be feasible for smaller community health hospitals, safety net hospitals, or even smaller provider groups. And so in comes Vendly. So imagine that I'm a small community health hospital called Out of Pocket Health Hospital. I have less than 100 beds, and the EHR system that I use is Canvas Medical. The two main problems that I'm trying to solve as a hospital organization is medical coding and billing, so I click those. And Vendly will output several vendors, AI vendors in this space. So for example, for medical coding, I can look at PhenoML, I can look at CureMD, and I can also look at some output metrics that I'm curious about. And for scheduling, I can look at Assort Health, I can look at PhenoML again, and the main part is that I can then integrate it into my EHR system, which is Canvas Medical, and evaluate these tools through a simulation using the data that I have from my hospital.
So over here, I have a demo of an integration where we're integrated with an EHR, specifically in this case, Canvas Medical, and I can pull my clinical notes, which is my hospital's data, and run it through the vendors. So in this case, I have two vendors. I have PhenoML and VendlyAI, and I want to evaluate their medical code extractors, which outputs ICD-10 codes. So behind the scenes, while this runs, this basically goes out and calls these two vendors, gets the results, and tries to evaluate them. And we use a LLM-as-a-judge to understand whether the results are accurate. So an LLM-as-a-judge, basically what that means is it uses another LLM to then judge the response of a output based on certain heuristics. So over here on the right, you can see the codes that the two extractors kind of outputted, and you can kind of see like a performance analysis of the two. And so some of the heuristics that we were using were just like latency, are the ICD-10 codes, like are they formatted correctly, are they valid codes, and possibly some conditions that may have been missed by the two. So we could do this with other types of vendors as well. So in this case, I want to demo a scheduling agent. So this is an agent that you would speak to schedule an appointment. So as part of this, we just have one vendor, and that's just PhenoML. And I can run these evaluations. And once again, I'm going to try to emulate a conversation to schedule an appointment. And I have some tests that I will run to judge the performance of the agent. So over here, you can see this one failed because there was some error that we ran into when talking to the API. But over here, we can also see that if the question is, I have an emergency, then the expected behavior should tell the user to call 911. And you can see that the reasoning that the LLM uses to kind of judge whether the answer was correct or not.
So in this situation, we're only comparing two vendors and for two use cases, but you can imagine that there are tens of thousands of AI vendors coming into the market, and it's getting harder and harder for hospitals to actually decide which AI vendors are best used for their system and actually deliver on the metrics that they care about. So Vendly is able to first simulate with these AI vendors based off of your own hospital data, and two, help provider groups, hospital systems, and even payors decide which AI vendor to pick. And so the next time you see another AI vendor, like all of the ones that have been pitched today, run it through VendlyAI.